and get started. I'm sure there's always some people who show up late, but they're lost. But we're going to go get started. So I'm Dr. Douglas Swan. I'm a minimally invasive spine surgeon, and also I do regenerative medicine as well, utilizing the stem cell technology, which also has a big, nutrition has a big part in. But today's topic is no more heart attack. So I believe that heart attack is unnecessary. Over 90% of the heart attacks can be completely prevented. And heart disease can be reversed, and hopefully I can convince you of that by end of this talk today. And then also today, I'm sure if you're interested in some sort of a fad diet, one of the most popular diet that's in America is ketogenic diet. Matt is going to talk to us about good and bad. There's really no good, and so debunking the ketogenic diet. And so it'll be a very interesting topic. I'm sure it's a topic that many people come across, and so wanted you to have a good information on that topic as well. So is this a first time to our plant-based seminar? Good. I'm glad to welcome. And so we have a seminar once a month, completely free, and each month we cover different topics, different disease. So obviously this month we're covering heart disease, and along with the ketogenic diet. And next month we'll be covering how to prevent, suspend, and reverse diabetes. And diabetes, just like heart disease, is something I'm more talking specifically about type 2 diabetes, which is the most common type of diabetes that Americans are suffering from, which can be completely prevented and then also be reversed. And even if you have type 1 diabetes, your symptoms can improve significantly. And then month after that, we'll be covering cancer. And so each month, we cover different topics. So we'll get started. So I'd like to start with this slide. This is a picture of Dr. Kim Williams. He was the formal president of American College of Cardiologists. And he said there's two types of cardiologists. The one who are vegan cardiologists and the one who hasn't read the data. Okay? So, and he believes a heart attack is definitely a choice. You choose to have the heart attack because you have a control of what you put in your mouth every single day. And when I see somebody eating a bacon, they're basically choosing to have a heart attack down the line. You're choosing to do so. You're having a hamburger, you're choosing to have a heart attack someday. I mean, maybe not immediately, but down the line, you are selecting to have a heart attack. And he himself wasn't started out as a vegan, and even as a cardiologist, and even he was doing everything he thought was right. He kept on seeing his cholesterol rising every single year. Even his exercising, even what he thought was eating right, just like I did also. And so then he went into this, even as a extremely well-known cardiologist, and he's head of the cardiology department at Rush University in Chicago, he still didn't have the information. And by end of today, at this talk, you will have more knowledge about how to prevent and reverse heart disease than a lot of the cardiologists. And because most people don't really, physicians don't know much about nutrition, and heart attack can be avoided. And some of you already know that I've trained at some of the biggest hospitals across the country, and learned how to do some of this big, massive surgeries. Right? That's what the big hospitals do. Do big surgeries. They don't change their ways because they don't have to. But I knew that wasn't right, so I spent the last 14 years in my entire career trying to innovate and develop more minimally invasive way of approaching the spine, and then also utilizing the laser so we can minimize the incisions and minimizing the violating the human anatomy. And I think the same can be said about the way we approach the chronic disease. We don't have to crack somebody's chest open to fix their heart, and it doesn't even increase the longevity of the patient, but simply through the diet and changing nutrition and lifestyle, you can completely reverse the heart disease. Okay? And minimally invasive surgery wasn't enough, and I wanted to take it up to the next level, and been working on stem cell therapy for the past 10 years. And what I found was, in order to have a successful outcome with stem cell therapy, you have to have the right nutrition. You know, just like you can't plant a plant in a concrete and expect it to grow, right? You got to pick the right soil, and we are the right soil. Our body is a soil, and you got to prepare it properly. And when you plant the stem cell, and the best way and then most successful, you know, outcome can be achieved if you utilize the plant-based nutrition. And there's a lot of science behind that reason. Okay? But you notice that all the hospitals are not getting any smaller. You know, with advanced technology, and there's so much innovation, there's artificial intelligence. But why are the hospitals just getting bigger and bigger and bigger? You look around even at DFW. In every corner, there's multiple hospitals. I just got a text message yesterday at the Medical City saying they are full. I mean, it's a massive hospital, but they're completely full. So they text all the physicians saying that you can't really admit patients there unless it's truly emergency. And it doesn't have to be that way. And most of the patients, if they took control of their health and you know, changed their diet and lifestyle, more than half of them probably don't even need to be admitted to the hospital. Okay? And this is a poor patient where, you know, it was an elderly patient with a lot of cardiac risk, needed the spine surgery, did have it, and had a mild heart attack, you know, immediately after surgery. Doing perfectly fine. But the next morning I show up to the patient's room, and this was the breakfast tray that he had. He had scrambled eggs, he had, you know, muffin filled with butter, fried potatoes, orange juice, butter, and milk, and oatmeal that he didn't even touch. Okay? This is at Baylor Hospital, right? And this is immediately after a patient who had a heart attack. So then right after this, I went to the physician's lounge, you know, to have a breakfast. And so it's not that much better. Okay? The physician's lounge has bacon, sausage, which is a category 1 carcinogen. Eggs weren't enough, so they put cheese on the eggs. There's scrambled eggs, and there's also eggs with the cheese, right? And then, of course, the pastry and regular yogurt, which is filled with sugar. And this is what they're serving the doctors. So just imagine what they're serving the patients. So, and then, you know, a little while back, there used to be an advertisement. So they said the more doctors smoke Camel than any other cigarettes. So you can't really follow what physicians do, right? You know, there was one cardiologist, a cardiothoracic surgeon that was in Denton. He's pretty obese, and he smokes, and he says, do what I tell you to do, now don't follow what I do, right? And as a physician, most of the time, we're just, you know, mopping up the you know, overflowing sink. The only one who can actually go turn off the faucet is yourself. It's your body, you have full control, but we're here to empower you with the knowledge so you can do it yourself, okay? Don't rely on physicians. And I recognize that, you know, when you're go to the internet, trying to lose weight, and then, you know, research different, you know, type of diet. There's so many different kinds out there, and, you know, who do you believe, right? But you got to look at the studies. What we, you know, as a physician scientist, I have to rely on evidence, okay? Unless they've done the studies, you know, and Dr. Greger says put it to the test, it's almost meaningless, right? And then, you know, you have somebody like Bob Harper, who was a big promoter of ketogenic diet. Okay, he was the celebrity trainers who was on Biggest Loser, right? Some of you may have seen the television show, and you know, he looks really lean, really fit, right? But it's not just about your weight loss. It's not about, you know whether you have, you know, obese body structure or lean body structure. It's what's inside. If it's rotting inside, it doesn't really matter. Right? And he even, you know, was on television shows, different TV shows promoting ketogenic diet, and also this is what they call bulletproof coffee. And they put coffee with coconut oil with the clarified butter. Okay? And because ketogenic diet, you got to consume a lot of fat. Right? This was what he was promoting. Then bam, at age 51, while he was working at a gym, he had a massive heart attack. His heart completely stopped. Okay? He was very fortunate that there was a cardiologist that was working out right next to him, and then the gym had the AED, and they cardioverted him. He came back to life. So this was, you know, him at the hospital, and then now he saw the light. Now he's promoting the high carb diet, okay? not high fat, high protein. So at least, you know, through the heart attack journey, that he learned what he really needed to do. And this is Dr. Crow. He's chief of breast surgery at Cleveland Clinic. hospital is probably most well known for their cardiology and cardiothoracic program, world renowned, right? So one day after a long day of surgery, he was in the recovery room writing orders like the typical surgeons do, and then all of a sudden he had a massive heart attack. Okay? If it was at his house, he probably would have died. Okay? But because he was at Cleveland Clinic, immediately rushed him to the cath lab, and where he died basically 3 separate times, but they were able to bring him back. So we'll go over a little bit more about his story as we go along. So heart disease is a #1 killer in this country. Okay? More than all the different types of cancers combined, heart disease. And you're more likely to die from a heart attack or heart disease, coronary artery disease, than any other chronic disease. So 1 in 4 of you will die of heart disease. And I hope not, because you came to the seminar today. Okay? But that is the statistics. And then here we have 10 different type of top 10 causes of death in U.S. and 9 out of top 10 are either preventable, reversible, or we can suspend it. Okay? So as I mentioned, 1 in 4 die in U.S. die from heart disease, okay? Cardiovascular disease. That's 1 death every 40 seconds. Okay, 1 death every 40 seconds. Right? Over 800,000 people die from cardiovascular disease every single year. There's 1 heart attack every 30 seconds and 1 stroke every 40 seconds. It doesn't have to be. Okay? So by the time we're done today, by 9 o'clock, from 7 p.m. to 9 p.m., there'll be over 180 people in this country who would have died from cardiovascular disease. Okay? But when does the heart disease really begin? Okay? So what percentage of the kids between age 12 to 14 do you think have early signs of atherosclerosis? Who says 10%? Who says 20%? 30%? Anybody take 50%?
I'll go 30.
50? Okay, 60? Okay, 70? 80? Right? Okay, 90? All right. So 65% of the kids between age 12 to 14 have early signs of atherosclerosis. Okay, 12 to 14. Okay, and so when I go somewhere, I go out for breakfast, I see kids eating eggs and bacons already at age 5 and 6. And no wonder. So they don't have a choice because they don't know what to eat. So the parents are setting them out without knowing, right? Setting the kids up so that they would have a heart attack down the line. Right? And 8% of the kids have more advanced lesions. Okay? It's not just early signs. 8% of the kids between age 12 to 14. But it doesn't even start there. Okay? So it actually starts in the fetus. Okay? So they were able to do autopsy, unfortunately, on the kids who died prematurely, and then and they were able to do an autopsy and examine their arteries. Okay? So the kids, the fetus, they came from mom who had high cholesterol, had significantly higher rates of early signs of atherosclerosis, fat streaks. Okay? So their vessels were already getting damaged before they were even born. Okay? So, whose fault is that? Right? So if you know, and there's some young folks out here, and if you get pregnant, then you want to keep that in mind. You want the best for your kids, right? So then you have to watch what you eat, because what you eat has a direct effect on your fetus. Okay? And obviously, this country, we deal with the crisis of obesity, right? Over 80% of Americans are either overweight, obese, or severely obese. Okay? 80%. That's with the BMI of 25 and greater. If you want to really live long, you need to be at a BMI of 23 and below. You have to be lean. If that's the case, then 88% of the Americans would be obese, overweight, and severely obese. And within a year and a half, that's 2020, 50% of the Americans are going to be either pre-diabetic or diabetic. Okay? And if you're diabetic, okay, then it's going to lead you to a lot of different things, and mostly vascular disease, heart disease, stroke, heart attack, and amputations, and blindness. That all relate. These are all complications related to the vessel disease. So this is a picture of my high school reunion, and some of these guys were the top athletes. I was a nerd, carried a big backpack, and I was on a tennis team, but they said they weren't real sports, and these guys were, football players, basketball players, but they represent, unfortunately, they represent American population. 80% of them are overweight, obese or severely obese. Back then, I was pretty close to being, overweight myself, okay? And I can't believe that's me, but that was me. Okay? And technically, I guess I wasn't overweight, but I was right at the borderline. But I also had high triglyceride and high LDL. Okay? And knowing this, I happened to run into my old an internist, and then he said, "Hey, I heard you turned into a fork over knife guy." I go, "Yeah, I guess so." And he goes, "Well, you have a high triglyceride." I said, "Yeah, so what's your point?" And he goes, that high carb diet, it's gonna get you, right? This is a very intelligent internist who's also on, Channel 8 News all the time as a guest, physicians, talking about different topics, right? Physicians don't know, okay? But, I made the change because I had difficulty fitting into my suit, right? Because, I started gaining weight, even though I thought I was doing everything right, okay? I was always been a health fanatic, and I was, that part of that group that did just like many other physicians, low carb, high protein diet, and it didn't work. My lab value didn't necessarily reflect, normal level. This is the graph representing what Americans are eating. It's the standard American diet. Americans are eating, 53% of their calories comes from processed food. 32% comes from animal products. 11% from fruits and vegetables and legumes, but 50% of that 11% is from French fries and ketchup. Okay? Ketchup is considered vegetable in this country. Okay? That's the problem, right? 4% from whole grains. So this is the standard American diet, sad diet, okay? Which causes obesity, heart disease, cancer, diabetes, and many other chronic disease. Okay? So, I'm going to show you a series of graphs here, and this is the incidence of cancer, and you don't need to look at the details, just look at the trend. Okay? The trend from early 1900s, incidence of cancer, to 2020, and look at the rise. Okay? And then now this is the diabetes. Look at the trend from 1950s until 2009. Look at the trend of the lupus, which is the autoimmune disease, from 1945 to 2005. Okay? Look at the trend of other autoimmune disease such as multiple sclerosis, Crohn's disease, type 1 diabetes, asthma. Okay? Look at the trend. Okay? Look at the trend of the amount of meat that Americans are consuming. Okay? This includes the red meat, poultry, and fish. Okay? And 2015, the average Americans are consuming 225 pounds of meat, animal products. That's a lot. Okay? And chicken, there's chicken place everywhere, right? I mean, I've never seen so many chicken places in my life. Every corner, there's some sort of a chicken place. But, 2018, we're going to be, well, not we, okay? Hopefully none of you. Americans are consuming 92.5 pounds of chicken, okay? And this past year at the Super Bowl, Americans ate 1.35 billion wings, okay? See the similarity with the trend? Okay, and this is cheese, another problem in this country. Back in 1909, Americans consumed about 3.8 pounds of cheese. Okay? And by 2016, 38.5 pounds of cheese. Cheese has 80% saturated fat, extremely high in salt. Also has casomorphin, that's why people are addicted to cheese. It actually has opioid, which is a byproduct. Okay? And casein is carcinogen. It's a dairy protein is carcinogen. And this represents what a normal artery should look like. Okay? It's patent, it's wide open. And if you have developed heart disease and develop atherosclerosis, you're going to develop a significant amount of plaque inside the artery. Okay? It also has cholesterol, has calcification, has smooth muscle cell that is infiltrated, and that becomes really rigid. It can't dilate when it really needs to. Okay? And the way it happens is that also this top portion is how the blood flows, and this is the wall of the artery. The LDL is the bad cholesterol that you hear about, gets infiltrated into the endothelium, into the arterial wall. Okay? And then your immune system recognizes it and then goes in to the arterial wall and gobbles up the cholesterol, and then becomes a macrophage, and then becomes the foam cells. Then it starts to damage the arterial wall. Okay? And then along with inflammation, the wall of the plaque becomes really thin. Then as the blood is flowing through, that sheer force, as the wall of the plaque gets really thin, it just tears apart. Then the platelets aggregate, so blood clot forms, boom, okay? You have a heart attack. Okay? That's how it happens. And some of the other inflammation happens with the formation of what we call trimethylamine, okay? And which gets oxidized. And this gets formed mostly by the animal products. Okay? When you eat eggs, chicken, fish, any animal products, okay, when you consume them and goes into your gut, it's your gut bacteria that converts them, carnitine and choline, into trimethylamine. Goes to your liver, then that becomes oxidized and becomes really inflammatory. Okay? That causes the vessel damage, that causes a heart attack, causes the stroke, causes the liver damage. Okay? And trimethylamine also can turn into what we call nitrosamine, which becomes carcinogen also. Okay? So we call it TMAO, trimethylamine oxide. So TMAO also increases the cholesterol to get deposited in the arterial wall. Okay? It's associated with the most severe cardiovascular disease. Oh, and then a lot of people think that fish is healthy. Well, fish happens to cause more trimethylamine than any other animal products. Okay? So, but plant-based nutrition, okay? If you eat plant-based, you don't have the gut bacteria. Okay? My gut bacteria looks completely different than omnivores, somebody who is eating meat. Okay? So if I happen to accidentally consume any animal products, I don't have the gut bacteria to produce trimethylamine, so I'm safe. Okay? As long as I don't continue to consume animal products. So in order to lower the TMAO, hey, you got to eat plant-based food. And there are fruits, vegetables, legumes, which are beans and lentils, whole grains, and nuts and seeds. Okay? And also in any animal products, especially the meat, chicken, they contain a lot of bacterial toxins. They call endotoxins. Okay? It triggers inflammation. Inflammation is root of a lot of different chronic disease, including cardiovascular disease. And so even you cook them, and then even you eat them, the acid in your stomach and the enzymes, it can't get rid of the endotoxins. Okay? So going back to Dr. Crow, the chief of breast surgery at Cleveland Clinic, so they were able to basically cardiovert him and bring him back to life. But because the type of lesion that he has in his coronary artery was way too long, so they couldn't do a bypass surgery. They couldn't also place a stent. They basically told him that they have to manage him medically, which is almost could be a death sentence. But he was very fortunate that his office was immediately right next to Dr. Esselstyn. And Dr. Esselstyn, who is a pioneer of plant-based nutrition, went up to him and said, hey, you have nothing to lose, so why don't you go ahead and try plant-based nutrition? He said, at this point, I'll try anything. So he did. And he stuck very strict to Dr. Esselstyn's protocol. And 2.5 years later, he had another angiogram. Okay? And this is the result. So on the left is when he had the heart attack, and on the right, 2.5 years later, that's his new cardiac arteriogram. It does not even look like he had a heart attack, right? It's completely clean. So he was able to reverse his heart disease, even after a massive heart attack. Okay? So quickly, I'm just going to go over some of the studies. Okay? And in America, obviously, heart attack and heart disease is very common. As I mentioned, it's the #1 killer in this country. But in different parts of the world, it's not. They don't have heart disease because they don't have standard American diet. Okay? So in South Africa, when they looked at, during especially the apartheid time, so blacks could only go to the black hospital, white would only go to white hospital. So they went to the black hospital and looked at all the admissions. They had approximately about 40,000 admissions per year, and they looked at 10 years worth of medical records. Out of 10 years, so there's 400,000 patients who's gone through that hospital. they only could identify 30 patients with heart disease. 30. That's like 0.0075%. Okay? They had no heart disease because they were poor, and then 90 to 95% of their diet consisted of plant-based. They couldn't afford to eat meat. But in White Hospital, they were more affluent. They had the same type of heart disease as the Americans did. Okay? Now they looked at the two cities. Uganda is known to have virtually no heart disease. So they did a 632 consecutive autopsies in Uganda as well as in St. Louis. Okay? And they did the same age and gender distribution. And out of 632 autopsies, they only found one patient in Uganda who had a heart attack. One. In St. Louis, 136 out of 632. So that's 21% versus 0.1%. So they went back to Uganda and said, okay, this can't be right. So they did another 800 autopsies in Uganda. And they found 0 death from heart attack. 0. There was one patient who did have a heart attack, it was small and it was healed, but did not die from the heart disease. So 0. Okay? And 95% of their diet consisted of plant-based. So it's not just in Africa. And so now we go to China. So Dr. Campbell did this massive study in China and published a book called China Study. And they're a small city, and I guess in China, 500,000 people is considered a small city. And they looked at these patients for 3 years. And during that time, there was 0 death from heart disease with people under age 65. Okay? So the common theme, no matter where it is, whether it's in China, in Africa, South America, no matter where it is, okay, the common theme is plant-based nutrition, and then that also allows people to have low cholesterol. And then most of the population in the small city in China and also Africa ate significant amount of fiber, okay, which we're going to go over also. So low-fat, high-fiber diet, not high-protein diet, high-fiber diet, and low-fat. And you want to maintain your cholesterol, total cholesterol, below 150, which is very doable and possible. So therefore, I find it, some people find it offensive. I don't know why, but I believe heart disease is a choice. You have a heart disease because you choose to have the heart disease. There are always a small percentage of exceptions. Okay? But overall, majority of Americans have heart disease because you choose to have the heart disease. Okay? And you can become heart attack proof. It is possible. Okay? And another person that everyone would know is like Bill Clinton, and he loved his hamburgers, right? And he loved his bacon. And he had a quadruple bypass surgery. Even then, he didn't change his diet. So a year and a half later, he had to have another stent placed. And finally, Dr. Ornish went and talked to him. Hillary called Dr. Ornish, and then he talked to Bill. And then he finally changed. And at that time, he started practicing whole food, plant-based, vegan diet. And now today, his heart is actually, stronger and better than 10, 20 years ago. Okay? So I'm going to talk about why the plant-based nutrition works, because you need to know why. There's many different reasons why, but this is one of the most important ones that we're going to cover. So these 3 guys in 1998 won a Nobel Prize for discovering what we call nitric oxide. This is something that we produce in our body every single day. Okay? And this nitric oxide gives you the ability to vasodilate. That means your arteries, it's going to dilate if your body needs more blood to flow to your muscle or wherever. Okay, and it's the strongest the dilator that we have in our body, and also does a lot of other things, such as it prevents the artery from getting thickening, and then also we talked about the foam cells, macrophage. It gobbles up the cholesterol and becomes a foam cell, which forms a lesion and causes the inflammation within the wall of the plaque. And it destroys the foam cells also, and prevents the smooth muscle cell from migrating into the arterial wall. Okay? And there's many other functions of nitric oxide, such as preventing diabetes, giving you more energies, activating the telomerase to build telomere, which is the stabilizer of your DNA. Also makes your mitochondria, which is the powerhouse in your body, in your cell, much more efficient, so you can produce more energy more efficiently. That's why when somebody becomes plant-based, the first thing they say is they feel like they have more energy, because their energy production in their body becomes much more efficient. Okay? So this is a test where somebody who had atherogenic diet, the standard American diet, okay? And then they gave them nitric oxide. So you can see the change. You can see the density of the blood that's flowing through the vessel, and then the dilation of the blood vessel. But unfortunately, okay, as we age, starting from age 20, we lose the ability to produce nitric oxide. The amount of nitric oxide gets produced in our body declines very, very quickly. So by the time you're 40 years old, because all the damage that you've done to your vessels by your choice, that you lose about 50% of your ability to produce nitric oxide. Okay? By the time you're 60, 85% of your ability to produce nitric oxide is gone, okay? Because of all the atherosclerosis and plaque formation inside the vessel. So then at that point, you really have to rely on nutrition in order to elevate the nitric oxide. Okay? But even though you decline at age 20, depending on your lifestyle, depending on your diet, you can control how fast you lose the ability to produce nitric oxide. If you're sedentary, and then if you're just with poor diet and not exercising, you're going to be in that red line. Okay? You're going to lose the ability to produce nitric oxide much sooner. But if you continue to exercise on a regular basis and have a proper nutrition, then you're going to slow down that process. So it is possible. Okay? So one way of doing that is, I always talk about a lot of dark green leafy vegetables. One of the protocols, like that Dr. Esselstyn's protocol, is eating whole food, plant-based, okay, no oil, and eating dark green leafy vegetables 6 times a day. So dark green leafy vegetables has a lot of nitrates. Okay? It's an initial substrate that basically turns into nitric oxide when you consume them. Okay? So there's 2 different pathways. Either you can do it orally, or your artery has to produce it. Okay? But you lose that ability to do so. And but you can still elevate the nitric oxide by having proper nutrition. And these are some of the things that you can consume. These are the dark green leafy vegetables that has high in nitrates. Okay? Nitrate gets, once you consume them, in your mouth, bacteria, again, it converts the nitrate into nitrite. So you got to have healthy bacteria in your mouth. So I recommend people not utilizing mouthwash, because mouthwash kills both bad and good bacteria, especially if it's alcohol-based. Okay? And Dr. Grieger recommends utilizing the green tea and using that as a mouthwash, because it gets rid of the plaque in your teeth just as well. And then once it goes to the digestive system, then it's in your stomach. It has to be acidic enough to convert the nitrite into nitric oxide. Okay? But your body also has the ability, it has an amazing ability to heal. Right? If you break your arm, if orthopedic surgeon like myself, we just set the arm, set the bone, right? And then your body has to heal on its own. So because it has stem cells. Stem cell is a type of cell that can differentiate so that it can repair and regenerate your tissues. We have them all over our body. Okay? Depending on what you do, you may have more or you may have less. But what they found was that even the endothelium, the inner lining of the artery, also has stem cells, which is called progenitor cells. Okay? And your body, you need nitric oxide in order to activate them so that it can repair itself. If you don't have it, you can't reproduce it. And now, at the Texas Heart Institute in Houston, they're trying to generate the heart tissues utilizing the embryonic stem cells. And what they found was, without nitric oxide, the cells will not differentiate and will not become heart tissues. Okay? That's the same technology, the same principles that we utilize when we are treating patients with orthopedic stem cells. Right? Somebody with knee arthritis, tendon or ligament injuries, rather than having the surgery, we can harvest their stem cells and introduce it. But the patients also has to do their part by having the right nutrition, and then we do provide them with extra supplements to help elevate the nitric oxide, but they have to do their part and by having the proper nutrition. There's another study where dietary intervention in Okinawa, where they gave them a lot of dark green leafy vegetables and healthy vegan diet, they have shown that they've been able to elevate the endothelial progenitor cells, which are the stem cells again, so then they can heal and repair and regenerate their arterial wall. Okay. So Dr. William Roberts, he was the editor-in-chief in the American Journal of Cardiology. He said the only critical risk factor for atherosclerotic plaque buildup is cholesterol, okay? Especially the elevated LDL in your blood. I don't know why there's a lot of thoughts, and when you go to the internet, well, your dietary cholesterol has nothing to do with it. If you see somebody who have a standard American diet and then draw their blood and look at their plasma versus somebody who have just eaten a whole food plant-based, which their plasma is pretty clear and you can see through them, versus somebody who just ate standard American diet, is extremely cloudy. Okay? I don't know if I have it in this presentation, but I have a picture of that. So, and then they did an autopsy of thousands of young accident victims. What they've shown was a level of cholesterol in their blood that very closely correlated with the amount of atherosclerosis they have in their artery. Okay? So the goal is to reduce the cholesterol, especially the LDLs. Okay? So a way to reduce it is avoid trans fat, which is mostly in processed food, right? And then animal products. Saturated fat, which is mainly in animal products and a lot of processed junk food, and cholesterol, which is only in animal products, especially eggs. Okay? Okay? So optimal cholesterol level, total cholesterol, you want to be lower the better. Okay? It has to be, the total needs to be below 150, and then LDL needs to be below 50 to 70. Okay? Lower the better. If you're below 50, you have pretty much, for the LDL, pretty much made yourself heart attack proof. Okay? So the way to reduce the LDL cholesterol, again, reduce the amount of food that has saturated fat, trans fat, and cholesterol, and eat more fiber-rich food. Okay, there, beans, right, and then whole grains, and such as barley, buckwheat, and fruits and vegetables. And most people are so obsessed with protein, right? You can get the proteins from plant food, not the animal products, okay? And lose as much weight as possible. So no matter if you lose weight, no matter how you do it, you are going to lower the cholesterol level, right? So cancer patients, they go through chemotherapy, they become skeleton, their cholesterol drops. It's not the way you want to drop the cholesterol, but by it's demonstrating if you lose the weight, your cholesterol will fall. Okay? But the most healthy way of doing that and achieving that is through plant-based nutrition. And a lot of doctors push on the statins, right? So there's other ways to do it, but the statin causes the liver and muscle damage, right? A lot of cardiologists that I know won't even take the statin for themselves, right? And even Dr. Crow said he would not take statin, and he did it through plant-based nutrition. And statin also increases your invasive breast cancer, not just regular breast cancer. Invasive breast cancer increases the risk by 2 times. Okay? And there's also memory loss, confusions, and increased risk of developing diabetes. So heart disease is a #1 killer, so it is important, but you're treating that with statin for another type of disease, right? But there are a lot of studies that have shown that Brazilian nut once a week works just as well as statin. Amla, which is an Indian gooseberry powder, which I promote to everyone. I think everyone should be taking turmeric, ginger, and then amla every single day. Okay? And turmeric along with the black pepper works just as well, if not better, than statin. Okay? These are all the studies, scientific studies. And then also kale and cabbage and flax seeds also helps you lower your cholesterol. So you don't need to take statin. You just need to be disciplined enough to convert, change to the plant-based nutrition, and eat all the right food. It's not about just avoiding certain type of food. It's about filling your body with the food that's actually going to heal you. Okay? Getting in the right micronutrients in your body. Okay? There's another study Dr. Dean Ornish did, another a pioneer in the plant-based nutrition, and looked at the patients with cardiovascular disease, and then randomized a certain 28 of them into a plant-based lifestyle, and then the other 20 who chose to stay eating the standard American diet. the usual standard American diet folks, their stenosis, constriction of their artery, okay, got worse over the past 5 years. Okay? And while the plant-based nutrition folks, their constriction significantly improved in the course of 5 years. Okay? But even among the ones who improved, who was within the plant-based, depending on how compliant they were with the diet, the degree of improvement was directly correlated. Okay? So if you're more compliant, you're going to get a better result. If you're not going to get as good of a result. Okay? And there were 2.5 times as many cardiac events, okay, with the control group who were eating standard American diet, and compared to the plant-based diet in 5 years after the study began. Okay? So with the plant-based group, there were 91% reduction in angina, chest pain attack within just a few weeks. Things happen so rapidly. You know, I have patients within a few weeks, their blood pressure went down to a normal level. They can discontinue their hypertension medicine. Same thing with the type 2 diabetic medicine as well. But on the control group who ate the usual diet, they had an 186% increase in angina attack. And this is again, cardiac arteriogram of a patient who had cardiovascular disease, and then 5 years later, their vessels started opening up, just like Dr. Crow's artery. And then down below is the PET scan. The blue represents there's no blood flowing into that part of the heart, okay, because they got significant cardiovascular disease. After changing their nutrition 5 years later, you can see on the right side, the blood starts filling in to the midsection of the heart. So heart disease can be reversed. Okay? 99% of the patients showed improvement, and the change was, they were able to maintain the change after 5 years of going to plant-based diet. Okay, let's see. I'm going to go through some of the other studies real quick because I want to make sure Matt has plenty of time. This is one with the low-carb diet. They did something called flow-mediated dilation. That's how your vessels react, okay? And it's measuring health of your artery. So it showed that the ones who were doing low-carb diet had significantly decreased in FMD, which is a flow-mediated dilation. Okay, so their artery, and a lot of the study was done in the college students. And even they're young and so-called healthy, if you give them low-carb diet, high-protein diet, their vessels, their arteries are not going to function normally. And this one is another, and this study by Dr. Fleming, this is actually a very important study. Initially, he began the study to see how the people with cardiovascular disease would react to low-fat vegetarian diet. But there were 26 of them, but out of 26, 10 of them decided to go on their own way, and they started eating the standard American diet. They gave up the vegetarian diet. Okay? So it actually became a better study, because 10 out of 26 was eating the standard American diet, and then 16 of them were eating the low-fat vegetarian diet. The ones who had the low-fat vegetarian diet improved their atherosclerosis by 22%. But the ones who switched and then started eating high-protein, the standard American diet, their vessel disease got worse by over 50%. Okay? And this is the spec of the arteries. The top one is the ones with participating in the low-fat vegetarian diet. So on the left, you'll see that you want to see greater amount of orange, you call it. That's the high density of the blood flowing. And here, you don't really see that much orange. And then after going through the nutrition change, and you can see how there's a significant improvement of the blood flow versus the one with the low-carb diet. Actually, it got worse. Okay? And the most importantly, you want to see whether you're going to live longer or not. So low-carb diet, this is a meta-analysis studies combining a lot of different kinds of studies that show that you do low-carb, high-protein diet, you're going to significantly increase risk of all-cause mortality. Okay. So I'm going to skip these studies. And then this study shows that, I get this question all the time, if you're doing whole food plant-based, you really got to either eliminate or minimize the oil. If you have heart disease, you should definitely eliminate it. And if you don't, you should try to minimize it as much as possible. Okay? And people always ask, well, is olive oil, extra virgin olive oil, isn't that healthy? I love doing a shot of olive oil first thing in the morning. And somebody told me that one time. There's no such a thing as healthy oil. Absolutely not. Is one healthier than the other? Probably so. However, this also shows whether it's olive oil or different kinds of oil, it still causes endothelial dysfunction, which means it prevents your artery from functioning normally. It's damaging the endothelium, inner lining of your artery. Okay? So these are some of the other slides of patients who have gone through whole food plant-based nutrition and lifestyle change. And this is a patient who had about 10% stenosis of their coronary artery, and you saw the improvement. Here is about 30%, and then their artery looks completely normal. Here's one that showed about 50 to 60%, again, completely reversed, 100%. So it is very possible. So this country, we spend about $77 billion in bypass surgeries as well as a stent. Okay? But sad thing is that even whether you have stent or not, it doesn't help you with chest pain or even death. It doesn't even increase your life. It doesn't increase your longevity. Okay? So why are you having such an invasive procedure, but you're not getting any result? Because most studies show that patients, after having a heart attack, within 6 weeks, they go back to their own diet. Okay? Most of the cardiologists will tell them eat a healthy diet. There's no specific heart diet that they recommend to patients. And then after 6 weeks, patients typically go back eating hamburger, bacon, eggs, and then they get another heart attack. Even you have a bypass surgery, right? Somebody's gonna crack your chest open and then do a bypass surgery. It does not prolong your life. None of the study, this is from the New England Journal of Medicine, the most prestigious medical journal in this country. They show that even you have a bypass surgery, it's not going to prolong your life. Only treatment that has shown to reverse your heart disease is changing your lifestyle, diet and lifestyle. Okay? So with the plant-based lifestyle, it is the most effective treatment option for your heart disease. Okay? It has the ability to heal and then reverse the disease. Okay? But not just heart disease. If it's good for your heart, it's good for your cancer, it's good for your diabetes, it's good for your strokes, it's good for your autoimmune disease and many other chronic disease. Okay? And then people say, well, heart disease runs in my family, right? So it's not so much, the family gene is really family recipe. Okay? You learn how to cook from your parents, and then they learn from their parents, and everyone, generation after generation, cooking the same meal over and over again. Okay? That's why. Okay? Family gene is family recipe, and you got to break that chain today. Okay? So, with plant-based nutrition, it is possible. Okay? You can prevent it, you can reverse it, you can suspend the heart disease. Okay? But you can't just do it with diet. I talk about lifestyle, right? So it's not just eating whole food plant-based. You got to exercise. You got to maintain an ideal body weight. Okay? You got to avoid toxins, such as smoking and alcohol. Okay? And you got to also learn how to relax, stress management. Okay? And if you follow these principles, then you can definitely make yourself heart attack proof. Okay? No more heart attack in this crowd. Okay? So Bobby Plunkett, I worked with him in the operating room back in August 2016. He had a massive heart attack and he had a stent placed. As he was being discharged from the hospital, the cardiologist told him just eat better. That was it. But fortunately, he got exposed to plant-based nutrition and changed his lifestyle completely. And since then, he lost about 70 pounds. And then in his last visit to his cardiologist, they couldn't even tell he had a heart attack. Okay? Okay? And this is somebody who follows me on social media. He just sent me a message because he heard one of the podcasts that I did in LA. And then on his own, just following the guidance that we provide on the social media, changed to plant-based nutrition. And that happened about 5.5 weeks ago. So since then, he had a pretty significant hypertension, but it's down to, I think it's at 124/72. Okay, and his cholesterol went from 262 to 162 in 5.5 weeks. Okay, so almost at where we want to be. We want to be below 150, right? But it only took him 5.5 weeks. Okay, and this is a parent of father of another person who follows me on social media, and you know, help them through changing the diet. You know, they live in Louisiana, so obviously he was in poor health. So the daughter got him to do a 60-day challenge of plant-based diet, and started in April 4th. So after 60 days, he lost 22 pounds, and his orthopedic pain gone, heartburn, acid reflux, irritable bowel syndrome, all gone. Cholesterol, total cholesterol went from 258 to 218. Okay. And then LDL from 180 to 144, triglyceride 196 to 124. You know, A1C dropped 0.3%, and then it now has a normal blood pressure, and discontinued 4 out of 5 medications he was on before. Okay. Just took 60 days, and then her mom also did the 60-day challenge, lost 26.6 pounds, cholesterol decreased by 31 points. And then triglyceride went from 325, I mean, that's like asking for stroke, okay, to 91 within just 60 days. And amazing. You know, A1C decreased also to 0.4 points, and then blood pressure is normal blood pressure at 110/80. Okay? And some people may say, well, you know, I'm too old to start plant-based diet. Well, this guy at age 72 in 1994 had triple vessel disease, hypertension, on 3 medications, right? And 20 years later, at age 92, he's got no heart disease, normal blood pressure, and no medication whatsoever. So it's never too late. And I just saw a post of a lady, she was 96 years old, and she started watching different documentaries, and you know, got on the internet, and she just recently started, you know, going plant-based nutrition. So never too late. And here are some of the other people who've gone through this journey, and here you can see, you know, many of them losing a lot of weight, but it's not about just the weight. Okay? It's about curing the heart disease, diabetes, you know, cancer, and all the other, many other chronic disease. So what's the diet and lifestyle that's going to prevent and reverse heart disease, you know, cancer, hypertension, stroke, diabetes, and then help you lose weight and keep them off, which is much more sustainable. And then not only helping you live longer, but also live younger, right? So what's the point of living long and if you're going to live like a vegetable, okay? And you want to eat the vegetable, not live like a vegetable. Okay? So it's the whole food plant-based nutrition is the way, okay? And here's a lot of other, you know, chronic disease that you can prevent, suspend, and reverse. Lots of different kinds. Majority of the chronic disease. Guys, even erectile dysfunction. Okay, that's the first sign of a cardiovascular disease. Okay, if you get on this journey, then you're going to reverse that too. Okay. So what is a plant-based nutrition? It's a whole, unrefined, or minimally refined plant food. Okay, think fiber, fiber, fiber. Okay. Okay. It's, you know, I recommend, this is the minimum. Okay. 4 servings of fruits every day, 5 servings of vegetables every day, 3 servings of whole grains every day, 3 servings of legumes, which are beans, you know, and lentils every single day. You know, serving or 2 of nuts and seeds every single day. The goal, which is very difficult to achieve because today's plants are not the same as it was 10,000 years ago, but the goal would be, you know, 100 grams of fiber. But there are still populations like, you know, in Tanzania that consumes 100 to 150 grams of fiber per day. And there's no heart disease, there's no cancer, there's no diabetes in that community. Okay? Also, you include a lot of different kinds of spices, whether it's turmeric, oregano, cumin, coriander, you know, paprika. I didn't know any of these until I started eating plant-based. And it's, you know, you don't need oil to season your food. You can use the spices. Okay? Consume a lot of water, and then you must eat vitamin B12 and vitamin D3. Most Americans are, whether you're vegan or not, whether even omnivores, are significantly deficient in vitamin B12 and are not at the optimal level. And most of us stay inside, and vitamin D is critical, so you make sure you take vitamin D3 also. Okay? These are the things that you want to avoid, okay? Any kind of animal products. Also, refined processed oil. Even if it's vegetable oil, it's processed. You want to eliminate them. Refined grains, okay, refined sugar, and anything that has cholesterol and saturated fat, no, okay, thumbs down, okay? So, and then this is a very common questions we get, right? Where do you get your protein? Well, I usually get back at them and say, where do you get your fiber? Right? But look at this, the biggest animals on this planet, and they're all vegans, right? They eat plant. The proteins come from the plants. That's where it originates. They eat them, and then they convert it into meat, and then humans are consuming the meat products, okay? Just bypass the middleman, go to the source, right? Look at these animals, okay? They're all vegans also, okay? And they're bodybuilders, they're professional football players, they're the strongest men, on the planet, the MMA fighters, hockey players. Then more and more professional athletes are becoming, plant-based vegans because they recover faster, they have less inflammation, okay? They're able to grow the muscles just as well as eating meat. Okay? So if you want to compare the beef to bean, 100 grams of beef to 100 grams of bean, they have the same amount of protein, 22 grams of protein. Okay? But the beans got 15 grams of fiber. Okay? The beef, 0 fiber. Okay? And then also the beans, 0 cholesterol. While the beef, it's got like 74 milligrams of cholesterol. Okay? The beans also has a lot of other micronutrients that you need in your system. Okay? So this is the principle that I live by, that I want to encourage everyone to live also. Call it Paralife, okay? To achieve optimal health. So plant-based nutrition, okay? You got to exercise, you got to move your body, okay? Avoid toxins, okay? And relax. So stress management, whether it is through yoga, meditation, any forms to help you relax, you'll be able to achieve optimal health. And we are going to be developing a website, and Matt and Mira is helping, playing a big part, and so that we can develop the right type of content. So we're doing seminars, but we didn't really have a way to get you the information on a regular basis. And so look for it, and we hope to launch it maybe in about a month or so, if we can get enough the content. So definitely look for it. It's going to be called wholegreenliving.com. So I always end my talk with this cartoon, and as the cows are being led to the slaughterhouse, it says, "My only consolation is that by eating us, they're killing themselves," which is absolutely true. Okay, and then there is a side effect, some of you have already seen this, side effect of a whole food plant-based nutrition. Okay, you may be tempted to wear something like this because you've lost so much weight. So I advise you not to do so.
No skinny jeans again.
So with the whole food plant-based nutrition, okay, you have now realized that heart attack is a choice. Okay, and you will learn that if you come to the seminar next month, diabetes is also a choice. You don't have to have diabetes, and most of the chronic disease is a choice. And my choice was to live in very optimal health, and this was me before. Don't like that picture, but this is me today. I'm 47, and I'm stronger and healthier than when I was 27 years old. Okay? And it is achievable by everyone, every single one of you. Okay? And it will help you achieve the optimal health. Okay? And you're also developing a kinder world for the animals. Only if you guys see why it causes disease, how they torture the animals, and then you have to really understand where your food comes from. And you're blinded, you don't want to know, right? But by actually paying and for those products, you are condoning it. You are allowing them to torture those animals. And I believe there's such a thing as karma. People are getting sick because what they are doing to those animals. Okay? And then also the meat industry by itself causes more harm to this planet than anything, okay? And has more effect on greenhouse effect than all means of transportation combined, okay? You want to be leave a planet for our next generations to come. As an individual, you can do more for the environment by not eating meat, okay? And if you drive those fancy electric car, you're really not doing very much, okay? And but even by just having one meatless Monday, starting out with that, you're doing more for the environment. So our next seminar, if you thought this was helpful, please tell your friends and family members. pretty much the same talk is going to be given this Saturday at the Treehouse in Dallas. It's 75 and Walnut Hill Lane. And then next month, and we'll be here. And so we have a monthly seminar here in Plano as well as in Dallas. We also have one in Fort Worth as well. Okay. And this is my this is how you can reach me in social media, whether it's a Facebook, Instagram, Twitter. Also, we have some videos, useful videos on the YouTube channel as well. And we have a support group, the Facebook group. It's called Regevity Plant-Based Nutrition. Everyone's welcome. I think that we started in December, November, December, and now we have about 700 members. Okay? Anyone can join. You don't have to, be practicing plant-based nutrition right now. If you have the interest, if you have questions, come and ask questions on this format. Share recipes, ask questions. The only rule is, be kind and be compassionate. That's the only rule, because if you're not, then you'll be kicked out. Okay? And then again, just plugging the website that's going to be coming, wholegreenliving.com, and then we hope to have launch that in about a month or so.